Right. Good morning. Charles Chima, Public Health Director for the City of Sioux Falls. So last week, during the Mayor's State of the City address, he hinted at a new collaborative that was being put together to address the problem of food insecurity in our community. And this morning, we're happy to provide more details and to make public the announcement regarding what this initiative is about. But first, I would like to start by providing a bit of background. So every few years, roughly about every 3 years, we do what we call a community health assessment, which is a very comprehensive effort to study health in our community. We work with our health system and community partners to take a comprehensive look of health in Sioux Falls. And we produce a report called the Community Health Assessment Report, or CHA. So last year, 2022, was one of the years, so the latest report was released last year. And one of the things, if you take a look at our report, one of the things we didn't mention at the time of this report was that we saw that, based on the last assessment, that there was the problem of food deserts or food access priority areas, which is the areas in our community that are designated as being low income and low food access, was getting worse. So the question then was, what could we do about this in regards to seeing that every member of our community has fair access to healthy foods? We believe that people's income, age, occupation, what they do, their background, where they live in our community shouldn't determine whether they have access to healthy and affordable food. And that is why we started looking at how can we bring solutions to this problem that is getting worse in our community. And again, the other question some people might ask is, why is this important? Why should we care about food access? We do care because we know that when people don't have access to a grocery store or supermarket that carries healthy produce and other fresh and healthy foods, what happens is they end up getting their foods from convenience stores like you might find in gas stations. And we know those don't always have the healthiest options. And that has a long-term impact on health in our community. If you think about conditions like diabetes, obesity, heart disease, a new report, for example, shows that as much as 58% of Americans might be obese by the year 2035, and that's a concern, right? So what can we do to see that our community members have access to healthy food? And that is why we started looking at how we can address this problem. So last spring, we put out the City of Sioux Falls with support from the Mayor's Office, from the Council, supporting the Health Department. We put out a call for applications, essentially for a grant program we called Eat Well Sioux Falls Grant. And the idea was to find a market-based solution because we recognize that this is about what is sustainable, right? There's a lot of good. This is a very, charitable, philanthropic community. We have a lot of people who volunteer their time and resources and effort to seeing that we help our community members when they need help. So we know we're a giving community, but we also know that the issue of food access is not something that we can solve by occasional food giving. We need to find sustainable market-based solutions to this problem. And that is why we put out this grant to try and identify a community partner who will propose innovative ideas on how we could help address food access in these food access priority areas. So this morning, I'm really proud to announce to you that we intend to award $250,000 to Sioux Falls Thrive to pilot what is being regarded as an Eat Well mobile market. And I will now invite Michelle Eppenbach, the president of Sioux Falls Thrive, to provide more information about this initiative that they're proposing. Michelle?
Thank you.
Pleasure.
Thank you so much. Gosh, it's good to see all of you here today. Thank you so much for coming. I'm Michelle Eppenbach. I'm president of Sioux Falls Thrive. It's great to be here today. I want to talk to you a little bit about the fact that I'm actually representing a coalition of folks today, a community coalition that proposed this Eat Well Sioux Falls mobile market. The vision statement that's on the screen, I'm going to read it for you for those folks that are online. The vision statement we worked with started with feed all the people, but it came out to be coming together to ensure equitable access to regular, reliable, healthy, affordable retail grocery options for low-income, low-access neighborhoods in Sioux Falls. It's important to understand this coalition that came together is now the advisory board that will work with the Eat Well Sioux Falls mobile market. And I was going to ask you all to stand to be recognized. I'm so excited that so many of you are here. But representing the organizations, First United Methodist Church, First Presbyterian Church, Church on the Street, Fair Market and Empower, Augustana Research Institute, Active Generations, Sioux Falls Food Co-op, Feeding South Dakota, Thrive's Food Security Action Team, and now after we knew that the grant was being awarded, we have invited a member of the City Health Department to be part of this advisory board. I want to give kind of a project overview for you quickly. The mobile grocery option will serve really two purposes. One, it will address the critical transportation barriers that we know exist, as Dr. Chima talked about earlier. It is difficult to get to a grocery store if you don't have access to your own vehicle. And we know that public transportation doesn't reach all those areas of need in this community. This mobile market will also serve as sort of an advanced scout for places that might be able to host potential permanent neighborhood grocery stores. This is also a great way to create and build on relationships that we have in the community with neighborhood residents who can help us then understand what really are those the needs in those communities. What's the local food culture? And one of the things that we talked a lot about was the grant uses the word healthy foods a lot. And one of the things we're going to need to do in those neighborhoods is determine what does healthy food mean in this neighborhood. And so those conversations, those relationships are super important. And then the last thing is improving affordability. One of the, this has to be, as Dr. Chima alluded to, has to be a retail option. It can't be a food giveaway. And so we've looked at a new business model that uses a stocking option using reclaimed grocery items that they have then a higher margin, a higher profitability per unit, and then those products subsidize the prices of more costly items. Shoppers are going to find, and this is an example on the screen, shoppers will find items like fresh produce, meat, and dairy products, and other staples, anything you would find in a normal grocery store. And it's a proven concept. It's already working in a lot of other places, including the United Kingdom and U.S. cities like Kansas City and Minneapolis. Our target startup date is around the beginning of school this fall. And so we'll be looking to announce more details leading up to September 1st. So then just want to talk a little bit about how this will work and what our expectations are as a group. First of all, the initial location and target populations will be in the Cliff and Benson area. The grant application included specific target areas of the community, and we started with this location based on some experience that Thrive has had there through the KidLink Riverside Initiative. Subsequent neighborhoods, places that will go after that, will be determined a lot by what the neighborhoods kind of ask for, what we prove, and really what that advisory board learns from the data. Potential impact in this area is, based on the 2020 census, there's about 6,000, little over 6,000 individuals in that neighborhood. Various races, including about 7% Hispanic or Latino, 9% Black, 14% Native American, and then other multiracial cultures. Housing units, about 2,000 occupied housing units in that particular tract right now, and so we see potential for some pretty high impact in that area. Community engagement then is one of those huge pieces that particularly Thrive is interested in, and the city had laid that out as an issue as well. There will be a lot of opportunity for neighborhood input, from just basic kind of focus groups to one-on-one interviews as things are happening. There may even at some point become neighborhood councils that really have an impact on what's happening with the mobile market. There is a potential then, and this is one of the great exciting pieces of this that we're looking forward to, there's a potential for creating community hubs around where the mobile market happens to be sitting at the time. Social service agencies have already started reaching out in terms of, can we bring services, can we share information? And the answer has always been yes. That this is a place where the community has the opportunity to come together and learn more. And at some points it might feel like a block party around the bus and around that vehicle. And so it's exciting to be able to nurture those neighborhood relationships. There will be volunteers that are around that are helping people feel comfortable and welcome. And so we envision a fun, really dignified place to do your grocery shopping. And then affordability and equity were two key pieces in the grant application itself. We talk about SNAP availability, the old food stamps for those of you that haven't caught up with the current terminology, but SNAP benefits will be available. Again, using that cost shifting model that changes how your more expensive items in a grocery store, it changes that cost ratio so that everything becomes more affordable across the board. The locations then will be based on a centralized, equitable access in those neighborhoods where we have the deepest concerns in the community. And then all of the things, the branding, the marketing, the social media, the customer service, and the reliable scheduling, all of those pieces aim toward a main goal that the group had from the beginning, and that's this be a dignified place to get your groceries, that this is not a handout, this isn't a freebie, and it really is a place that we all feel like customers. And so that's part of it. And the big question is, where does Thrive fit in all of this? You know that Thrive is the community's Cradle to Career Workforce Development Initiative. We were created 5 or 6 years ago by leading organizations in the community to really bring together community leaders to remove obstacles to student success and to foster opportunities for all children. And so Thrive uses what's called a collective impact model, which means we bring together folks around these various topics, and the 3 topics that we focus on right now are food security, obviously, affordable housing, and out of school time. For this 2-year pilot phase of the Eat Well mobile market, Sioux Falls Thrive will provide what we call traditional backbone organizational services, similar to the model that we used with the KidLink initiative that you see being handed off to the school system at this point. So we'll do things like project oversight, facilitation support for that advisory board, full and part-time staffing positions will run through Thrive, Augustana Research Institute support will come through Thrive, human resources management, payroll, bookkeeping, marketing, social media, all of those kinds of things will be Thrive's role in this pilot project. And as just kind of an example, this is what the org chart looks like. The advisory board has their hands directly in the work, and many of them are standing over here on the side of the room. I'm excited to have them here. Thrive will then do all of those, the basic sort of back office type things. And then there will be a market director. The mobile market will have its own director. And then there will be drivers and volunteers and customer service people and all of those sorts of things. So that's how that's expected to work. Then the big thing that the city's grant opportunity requires is evaluation, and that's how we're going to figure out what really works and what doesn't when it comes to this project. So we're looking at sustainability, really what's the bottom line. Our current financial projections make this look like it will start to be self-sustainable in 18 months, in that 18-month time period. Access is a huge piece. SNAP benefits will be accepted. And we've even talked about that concept of what if you are eligible for SNAP benefits, but you haven't applied. Maybe there will be social services folks there that can help you fill out that application. Trying to think broader about what a grocery store can be. And then we're talking again about affordability. That market basket price comparison is going to be critical in our evaluation. Lots of shopper feedback is going to be involved with the evaluation. It's a vehicle. It's not a giant, box store. Are the things that are on this vehicle the things that you're looking for in your neighborhood? That kind of feedback. Is it easy to get to? Is it healthy in your perception? And then we'll do, in-person surveys and interviews that make sure that we're keeping track of what the neighborhood is about. And then long-term outcomes, we'll be looking more at national benchmarks. Let's make sure that we're, that the community-wide, but particularly in these neighborhoods, are we looking at obesity numbers? Are we looking at heart disease numbers? All of those kinds of things will be part of that evaluation. And then it's all about, in the end, collaboration between not only the Eat Well Market Advisory Board and Sioux Falls Thrive, but between this organization and the community as a whole and the city specifically. And so lots of exciting things to come. And Dr. Chima, would you like to wrap it up?
So really, really excited about this project. And so next week at the City Council meeting, the contract to formally award this grant to Thrive will be on the agenda. And again, we firmly believe that who you are, where you live in a community, how much money you have, how much education you have, should not have an impact on your access to healthy food and opportunities to be well. So really look forward to the impact that this Eat Well mobile market will have on the neighborhoods and our community as a whole. And we'll now invite the media and everyone in the room to address any questions that you might have. Thank you. Yes.
Just so I can understand, so it's the mobile market, it's not like it's going to be like a food truck going between the areas, it's like a bus that'll be stationed hopefully in each priority area eventually?
Right, exactly. The question was, is it like a food truck or is it more like to be fair, we've looked at a couple of different options for what the vehicle will be. And in our imagination originally, because this is the way the model has worked in other places, is that it's a decommissioned bus. And so you can imagine, it's a grocery aisle and there are groceries on either side. And so it's a larger than a traditional food truck, and it won't provide those sort of ready-made meals. It is going to be true grocery items.
When you talk about this being a pilot program, I think this is part of the evaluation near the end, but are you looking at the potential of further mobile markets or the more permanent grocery store options? I guess, what is the potential of this pilot program in the
Right,
future?
and that's a great question. And the question is, what's the potential for the future on this particular project? Is it something that might replicate itself across the community? And the answer is yes, but there are options for, we've talked a lot about, and you'll see it in the grant application, we talk about it as a scout for certain locations. So let's take that mobile market into a neighborhood where there might be potentially already, maybe there's a vacant strip mall place in that neighborhood we're working in. You take that mobile market into that neighborhood, prove the need, and then can develop that neighborhood level market that's more bricks and mortar. But there are other places, particularly if you look at the census tracts that we're looking at in terms of those low access areas, there's some of those places that are pretty far out there in terms of, if again, think about yourself as a family without a vehicle of your own, and you're far out there, there's not a place there where we're necessarily going to be able as a community to build any kind of building. There's not that empty, perhaps strip mall option that I suggested. Maybe that mobile market becomes a permanent option for that neighborhood. But you're right, the bottom line is it's going to come down to that evaluation. It really is, we're going to take this as a community and really look at what are the best ways to do this. Does it work there? And if it doesn't, maybe we need to move it somewhere else and do it based on the data that we're learning from the feedback that we get.
The parking lots or where you go?
That's a great question too. The question is, will the mobile market be in parking lots or where will it be? And we have envisioned some of the locations as parking lots, but if you look at the mobile market in the city of Minneapolis, it literally pulls up to, stays on street side in front of an apartment building and rolls through. And if you look at their Facebook, which eventually this unit will have as well, it's going to be from 2 to 5 at 123 Sesame Street, right? And then from 5 to 7, it's at a different address so that it stays right on the street. It's going to depend again on the locations and the need in those neighborhoods. Megan, yeah.
Can you talk a little bit more about the model in terms of how you're sourcing food? Are you going to have to have a storage facility as part of this, or are you anticipating the food will all be stored on the bus? How does some of the logistics of that work? And
Right.
how the grant funding?
Really great. The question is about logistics in terms of stocking and how do we keep track of the food, all of those sorts of things. And so think about, yeah, exactly. We got to figure out how do you keep the lettuce cool and the meat colder and the milk is available. All of those kinds of questions go along with that. And then I want you to think about, look again at the list of our partners, and one of them is the Fair Market team, and they're here today. And we will be using a similar model to that overstock grocery model that's being used with Fair Market, but it will then include, and they're adding those as well to Fair Market, but we'll have freezers and coolers so that we're able to provide dairy, fresh produce, and meats.
Freezers include on like the bus?
On the vehicle, yes. Yeah.
Is 250,000 enough? You gotta do more fundraising.
That's a great question, Patrick. The question is $250,000 enough? And the original, the answer is, in a short answer, is yes, it is. Absolutely, it becomes self-sustaining at 18 months based on all of the pro forma that we've done in terms of, here's how much this is going to cost, here's how much that's going to cost, here's how much we're going to pay staff, all of those kinds of things. It will get us to the 18-month mark. Other questions? Yeah.
Are there other ways, people are seeing this story and think this is a really cool initiative, how can I support? Are there other ways that people can get involved in the work that you're doing?
Absolutely. The question is, are there other ways for people to get involved with what we're doing? And the answer is absolutely yes. And it'll eventually have its own Facebook page, but in the meantime, if you're interested in tapping into what we're doing right now, hit email to info@SiouxFallsThrive.org. Totally open to ideas and volunteers and those sorts of things. This team, the advisory council that was on the list, will remain static, but there are folks that are going to come and go based on their specialties. There will be a need for volunteers when the mobile market is out there. We're going to need that welcoming, homey sort of feel that goes along with a neighborhood market. And there will be opportunities for folks to participate in some of the strategies that are going to go into how do we really make this roll. We're just getting started, folks, so we're absolutely welcoming. If you've got an idea, you've got some time that you can give us, absolutely send us an email. Yeah.
Is the expectation that this will, at least throughout the pilot program, eventually be on a cycle of some sort once these effective locations are determined? Because I assume if someone like Clifton Benson, becomes somewhat dependent on this program, they'd be hopeful that it would return at some point if it's moving throughout locations.
Right. Right, exactly. The question is, will it eventually be on a regular cycle so that if you lived in a particular neighborhood, you could expect that the mobile market's going to be there at a certain time? And the answer is yes, absolutely. That will, certainly during those early phases, there will be times when, we figured out that right at Cliff and Benson, for example, is not a great location for this, and we know that to be a fact. We've already looked at that location, but there are housing developments very close to that area, and so maybe it sits in a certain place for 2 or 3 or 5 weeks, whatever it is, until we determine that we think that that's right. Maybe it stays there and it continues to be there. It's every Tuesday afternoon at such and such a time, but it will always be, it will rely heavily on that Facebook model of social media being it's really snowy on that street today, and so we're going to be 2 streets over where it got plowed, so that we know that it's absolutely has to be reliable. The first thing we have to do with neighborhoods is to build trust, and that it will be a schedule that people can manage, and that will fit in their schedules as well. Yeah?
Just one last quick question, this might be for Dr. Chima. Does this exhaust the city's Eat Well Sioux Falls funding, or are you still taking applicants for this program?
So that's a good question. So at this point, yes, application is closed for this program, and we're going to look at how this pilot goes out and kind of see what we learn. Really, a lot of the questions here, it's going to be what happens next, right? What's the future? And I think that's why we're taking an evidence-based, data-informed strategy to see what we learn with regards to using the community engagement model. Really, ultimately, it's about bringing a sustainable solution for healthy food access in these parts of our community. So what we learn will kind of inform the long-term strategy here, and we'll kind of provide all the support we can to this initiative to see that it succeeds in the pilot, and we use the findings to inform the long-term engagement.
It goes that door to door. I mean, neighborhoods are not huge. Social media is one thing. I don't know if everybody reads the code out. I can't do it, but
Right.
you have to go door to door and say, come to you.
Right, that's a great question. The question is, how else besides social media, and that's one of the things that we've looked at, particularly in the KidLink model, is that there is such a digital divide in some of these neighborhoods that we're working in. Yes, there will absolutely be. That's one of those places we're going to need volunteers. There will literally be a door-to-door campaign. and including other, let's do some billboards and traditional media, those sorts of things. So, but absolutely, we'll be going door to door and talking to folks about, here's the opportunity for you, and asking too, what it's coming to your neighborhood. What should it be for you?
Is this
Yeah.
something they also communicated through like other nonprofits, say like the Bishop Dudley, things like that, where they're going to also be raising awareness for this?
Absolutely. The question is about how else might nonprofits be involved with sharing the information, and that's one of the great things about this community is we have a wonderful network of nonprofit organizations, including the Bishop Dudley and others, that will be key players in how this all gets out to the community as well. You bet. Any other questions? I would say all the folks except Vanessa over there are members of the advisory team, and so if you're interested from a press perspective, if you would like to chat with them, they spend a ton of time. The thing that I talk about with our collective impact model is that it's hard work. It takes a lot of time, and we have to come to consensus on everything. This group of folks met every week for 3 months to pull this idea together and to get over some of the humps of, gosh, do you really think we should do a mobile? Isn't there a different way to do this? This doesn't sound like it might work, but we got through all of that conversation through a collective impact model as a community collaborative. So those folks are here as well.
Thank you.
Thank you.